Stress in the aging population can cause new health problems and worsen existing ones. Experts say stress can even speed up the aging process. In today's Aging in Place, we're chatting with Dr. Ian Reynolds with Carilion Center for Healthy Aging. Good morning, Dr. Reynolds. Thank you so much for coming in this morning.
Good morning. Thank you for having me.
So first of all, what does the Center for Healthy Aging do?
The Center for Healthy Aging does a lot of things. We have a robust staff of clinicians, social workers, nurses, all working towards the goal of aging well. A lot of what we do is managing cognitive concerns and dementia, but we expand beyond that. We have geriatric psychiatrists, we have palliative care, so we offer a lot of robust services for our older population in the region.
Yeah, and a lot of it, of course, beyond the physical concerns, we're of course talking about stress and how it can manifest itself in everyone of, every age, but certainly in seniors, it can make their conditions even worse. So, what are some things you all do to help families, navigate aging with their loved one to sort of relieve some of the stress?
Yeah, I think, again, we know that aging in place is, a really important phenomenon. We know most people want to stay in their homes. That's where they're most comfortable. They've been there for decades and they want to remain there. And we're on board with that plan. We want to do everything we can to make sure that that can happen. So we give tools and resources for family members or for patients and can really just alleviate that stress and sort of the unknown that can happen with aging. And so we shine a light on that and provide a lot of useful counseling and resources and continued follow-up. Like we're a place where there's continuity of care beyond their own primary care providers, where they can look to us for advice and things along the way.
Oh, sure, because primary provider, of course, your first, that's the face that they know that they can ask questions of, but you all can also help people, navigate maybe making their homes safer for them so they can stay in them. That's
right. And it can be as simple as, advocating for decluttering a space, increasing lighting in certain spaces, all in an effort to reduce fall risk. There are even things we do in terms of saying, hey, is there a way where we can try to bring your living to the ground level where you don't have to navigate stairs or other things that might pose a fall risk as well. And we often advocate for resources in the home, bringing in other services that may be useful to provide that extra layer of safety beyond what family can offer.
Yeah, and also, counseling, of course, I'm sure with, medical needs, what insurance covers, what insurance doesn't cover, because money can also contribute to stress.
It does. And I'd say that a lot of people are surprised maybe when they're looking at resources and looking at what insurance covers and find that maybe it's less than they had thought. And so, we offer some planning and some foresight so there aren't those surprises later on when people are looking to increase resources in the home. And we recognize that each insurance plan is a little bit different and they're nuanced, especially if people have Advantage plans with their Medicare. But we can look at those individual plans and say, hey, I think this is a resource that would be helpful for you.
Yeah, perfect. All right, Dr. Reynolds, thank you so much for coming in and for everything that the Center for Healthy Aging does. You'll find a link to Carilion Center for Healthy Aging along with this full interview later this morning on our website, WDBJ7.com. Just click on Morning. Stay with us. We'll be right back.